Hello and welcome to our presentation on the effects of spinal anesthesia on inpatient length of stay. This evidence-based review was conducted by Jordan Diehl and Anastasia Kosiewicz under the guidance of the Carroll College Department of Nursing. Our decision to research the relationship between types of anesthesia and total knee arthroplasties was largely influenced by shared interests regarding biochemistry and the pathophysiology of anesthetic medications. To examine the topic of total knee arthroplasties, spinal anesthesia, and patient length of stay, we asked the question, for patients undergoing total knee arthroplasty between the ages 45 to 80 years old, is the length of hospital stay decreased in patients who receive spinal anesthesia compared to those who receive general anesthesia? The terms section provides definitions that are most pertinent to the question at hand, which include total knee arthroplasty, spinal anesthesia, and general anesthesia. Total knee arthroplasty, or TKA, is the process of bone and cartilage removal of the knee, and metal and plastic material is used to repair the joint. Spinal anesthesia, or SA, is a type of neuroaxial anesthesia that involves injecting an opioid or local anesthetic into the subarachnoid space in the spinal cord. General anesthesia, or GA, is a combination of sedatives, analgesics, amnesias, and benzodiazepines to achieve full unconsciousness of the patient.
The background provides further information on the terms discussed in our paper, as well as further information on why this is an important study to further research. According to the National Center for Health Statistics, from 2000 to 2010, an estimated 5.2 million total knee replacements were performed, and 98.1% of those were within the 45 and over population. Further adding to this, the average age for primary TKA recipients has been reported at 67. Older adults or geriatrics are a population that tend to already have an increased risk for post-operative complications and a longer length of stay, which is an important indicator of post-operative outcomes and risk for further complications. Indications for general or spinal anesthesia regarding total knee arthroplasties is based on the anesthesia provider's discretion. General anesthesia has been the gold standard for any invasive procedure, like a TKA, until recently when providers noticed decreased side effects and increased patient outcomes associated with spinal anesthesia. Use of anesthesia causes loss of feeling, memory, voluntary actions, and loss of skeletal muscle function. Common side effects from both general and spinal anesthesia include nausea, vomiting, headache, respiratory depression, apnea, laryngeal spasms, hypotension, slow heart rate, itching, confusion, drowsiness, and delirium.
In the middle section of our poster, a general overview of the 4 peer-reviewed articles is provided in attempts to answer the question. The first article is titled, "The Effect of Neuroaxial Anesthesia on Postoperative Outcomes in Total Joint Arthroplasty with Rapid Recovery Protocols." This Level 4 retrospective cohort study is non-experimental and without randomization. Overall, the findings of the retrospective study show that the patients who had TKAs and received neuroaxial anesthesia or spinal anesthesia had a significant decrease in LOS compared to the TKA patients receiving general anesthesia. The study also indicated that an increased utilization of spinal anesthesia may improve patient outcomes and decrease costs associated with procedures like TKAs, and should be considered for addition to rapid recovery protocols. The second article, titled "General versus Spinal Anesthesia for Revision Total Knee Arthroplasty, Do Complication Rates Differ?" is a Level 4 retrospective cohort study, which suggests that while overall rates of complications were similar between spinal anesthesia and general anesthesia. Spinal anesthesia does offer some benefits when compared with general anesthesia. In addition, length of stay significantly decreased in the spinal anesthesia group compared to the general anesthesia group, even after controlling baseline and operative characteristics.
The third article, titled Comparison of Short-Term Complications of General and Spinal Anesthesia for Primary Unilateral Total Knee Arthroplasty, is a Level 4 non-experimental retrospective cohort study without randomization. This study's results showed that patients who received general anesthesia not only had an increase in pre-operative and post-operative room time, but that their post-operative hospital stay was significantly longer than those patients who had received spinal anesthesia. This study also found that the incidence of blood transfusion was significantly increased in the general anesthesia group compared to that of the spinal anesthesia group. There was also found a higher incidence of surgical site infection in those who were receiving general anesthesia. The fourth article, titled General Anesthesia Leads to Increased Adverse Events Compared with Spinal Anesthesia in Patients Undergoing Unicompartmental Knee Arthroplasty, is a Level 4 retrospective cohort study. Overall, this study concluded that increased operative time, as well as the occurrence of severe adverse effects, higher rates of DVT, superficial surgical site infections, and a reduced likelihood of discharge to home were all associated with the patients receiving general anesthesia. The study further states that spinal anesthesia is associated with a significant decrease in the risk of both major and minor adverse events. The study didn't state any significant difference in hospital length of stay or readmission rates found between the two groups. After critically appraising the articles and synthesizing the evidence, we made the following conclusions. Spinal anesthesia may be the most appropriate anesthesia intervention in patients receiving total knee arthroplasties between the ages of 45 and 80 years of age. Spinal anesthesia may also improve the outcome and quality of life in patients undergoing total knee arthroplasties and offer benefits to both low and high-risk patients. There is also strong evidence to suggest that spinal anesthesia can significantly decrease the length of stay for patients receiving TKAs. To fully address the scope of our PICO question, additional research that allows for comparisons, generalizability, and a randomization along populations is warranted.
The direct application of the information discussed throughout this systematic review into nursing practice is absolutely crucial to provide high standards of care for all patients. Nurses can provide evidence-based education to patients and other healthcare providers regarding the advantages associated with spinal anesthesia and disadvantages associated with general anesthesia, which advocates for patients and improves outcomes such as length of stay. Nurses, specifically Certified Registered Nurse Anesthetists, can educate coworkers on the recent studies that provide evidence suggesting improved patient outcomes with the use of spinal anesthesia. Nurse researchers can also use this information to develop new studies to further examine the relationship between spinal anesthesia and postoperative outcomes in total knee arthroplasty patients. This information, combined with reflection on impacts of the healthcare team, can empower nurses to realize that small changes in clinical practice have the capacity to greatly impact patient outcomes. Holistic care and highest quality of life depends on proactivity and advocacy of nurses for their patients. Thank you for listening.